All right. So we are looking at another complication in childbirth. This is what is known as Meconium stained liquor. Meconium stained liquor. So this is a Meconium liquor, Meconium stained liquor. So just from looking at it, all right, Meconium stained liquor. So it just refers to the presence of meconium, right? So meconium is the first stool that a newborn will usually pass out, all right, in the amniotic fluid during labor or delivery. So it's a sign that the baby has passed stool before birth. So most of the times, in the case that the baby is distressed or the baby has gone past the time that it's supposed to be in the fetus. So what is meconium in the first place? It's a thick, it's a sticky, it's a greenish-black substance made up of intestinal cells, bile cells, mucus, So it's normally passed after birth, but in some cases, it's released in utero. So normally it should be after birth, but sometimes the baby is too stressed or is delayed here, then you have it being passed in utero. Okay, so why does it even matter in the first place? Meconium in the amniotic fluid can be harmless, especially in post-term pregnancies. However, thick, dark green meconium may signal that there's fetal hypoxia, that's lack of oxygen. All right. So the biggest concern is what? Meconium Aspiration Syndrome. This is when the baby has passed their stool inside the amniotic fluid and is inhaling it. All right. So this is where the baby inhales the stained fluid into the lungs, leading to breathing difficulties, inflammation, or infection. All right. Then can also cause to lead to what? Respiratory failure. Okay. So risk factors is post-term pregnancy. So if the baby has stayed past the normal time that is supposed to be in the uterus, prolonged or difficult labor, maternal conditions like the mother has hypertension, diabetes, placenta insufficiency, if the mother smokes, all right, or have abused one or two substances during the pregnancy. Okay, so management during labor is continuous fetal monitoring if meconium is dictated, if the fluid is sticky or lumpy, delivery may be expedited. A neonatal team is usually present at birth to manage any breathing issues. The routine suctioning is no longer recommended unless the baby is not vigorous at birth. So that's just what the meconium stained liquor simply means.